How would you define the predictive value of a diagnostic test? We've been talking about it, throwing it around. How do you define it?
Yeah, well, it's interesting. As a physician and as a payer, think about prediction. My question is, does this test predict response to treatment and a specific treatment? So if we look at, for example, colorectal cancer, a KRAS mutation suggests that you will respond to specific drugs, Erbitux and Vectibix. In this space, neither Oncotype DX nor PAM50 or Mammoprint, for that matter, predict response to specific therapy. They predict response to chemotherapy, but nothing beyond that. So that's what I would define as a predictive test, something that helps us define what optimal therapy is for that patient.
So let's talk about a strong correlation between genotype and phenotype, all right? Now, does that determine the positive predictive value of a diagnostic?
Does that determine the positive predictive value of a diagnostic? The more clarity there is around what appropriate treatment is, the better it is for patient, provider, and payer. So yes, I would say that strong correlation and that strong predictive value has value to everyone.
And what additional information would you like to make a diagnostic test even more predictive?
Sure. A predictive test increases the probability that the patient is going to respond to that therapy. What we'd ultimately like, though, is a test that also allows us to determine whether or not patients are actually responding. There might be an 80% probability that patients respond, so can we identify those 20% who aren't responding earlier on?
You're looking for a tracker.
I'm looking for a tracker.
All right. Well, if Prosigna identifies the same high-risk group of patients with the same prognostic outlook as those recognized by Oncotype DX, who benefited from systemic chemotherapy, would that make Prosigna equally predictive?
What we're really asking is, do both of these diagnostic tests convey the same outcome value to patients? As a predictive test, both of the tests indicate that you're likely to respond to chemotherapy. It doesn't say which chemotherapy. In fact, in the NASBP 20 trial that was done 20 years ago or more, we were using chemotherapy regimens that aren't used today. So really, as a predictive test, neither of them had the ability to tell us which chemotherapy patients will respond to, other than that they have responded to some in the past.
All right, well, thank you very much.
Yeah, you're welcome.